The Social Work Care Collaborative is located in the BCHS Interprofessional Clinic. You can find us at Leon Levine Hall, located at State Farm and Deerfield Roads across the street from Watauga Medical Center. We partner and collaborate with people in the community, as well as other departments within the university, and we also have services available to Appalachian State University students.
Our program has three main goals: to develop and provide continuing education regarding neurodiversity, to engage graduating education majors in professional development training to strengthen their confidence, understanding, and skills in working with children with neurodiversity, even if the children are not identified as exceptional children or EC, and to collaborate with families, teachers, and people with neurodiversity for the development of the training and to facilitate engagement. The immediate plan is to develop and provide continuing education for graduating and new teachers to support them in developing a deeper understanding and additional skills regarding the challenges of neurodiversity, how to recognize learning needs earlier, how to directly address these challenges in the classroom. Eventually, we could advocate for changes in legislation that would require more training in this area for students in the education track in their undergraduate and graduate programs. Microservices can also be developed for these families and children.
Families and students with neurodiversity report a disconnect between teachers and themselves, and students are having difficulty coping with their education in the mainstream classroom. Teachers from across the state, both in general education and EC graduate teachers, report feeling underprepared. The children who do not qualify for EC services may struggle the most because they need extra help or because they might get in trouble because their behaviors or responses do not fit in with the rest of the class. Teaching Every Child is a collaborative effort between Parent-to-Parent Family Support Network of the High Country, the Social Work Care Collaborative, and other university and community groups to address service gaps in the educational system for families and children with neurodiversity.
Part of our role at the Interprofessional Clinic is to provide psychoeducation and outreach to the community. One of the ways we accomplish this is through our partnership with the Watauga Compassionate Community Initiative, or WCCI. The mission of WCCI is to promote health and resiliency in our community and to effectively prevent, recognize, and treat trauma by creating safe, stable, nurturing environments and relationships through education, advocacy, and policy change. The social work interns at the Interprofessional Clinic are available for private and public presentations on the impacts of trauma and the effects of toxic childhood stress, or ACEs, which are adverse childhood experiences.
Aging Well screenings. The BCHS Interprofessional Clinic is now accepting appointments for their Aging Well assessment program. This program covers assessments that are provided free of charge and may not be typically offered by your doctor. The program will be monitoring health indicators that relate to aging, such as cognition and memory, balance and fall risk, behavioral health, and nutrition. Participants can use information from the results of these screenings to learn ways to improve functioning and health. Those performing the assessments are App State students who are training for their health careers. These screenings are provided at no cost and are available to anyone in the community, regardless of age or university affiliation. Everyone can benefit from these screenings, whether you're in your 80s and concerned about fall risk, or if you're in your 30s and just want to be proactive about your health. We are looking forward to your participation in this program.
Social work interns at the Interprofessional Clinic offer case management, service navigation, access to services, tracking, and follow-up for clients in the community and ASU students. These interns offer brief, solution-focused, problem-solving support.
We are accepting referrals for individual counseling from contracted agencies, ASU programs, or some self-referrals. We are able to help individuals, couples, and families who may be facing depression, anxiety, adjustment disorders, challenges with executive functioning, ADHD, autism, or other concerns. Community agencies call the Social Work Care Collaborative at 828-262-4028 and ask for a supervisor to set up an MOA for referrals.
The BCHS Interprofessional Clinic is now accepting referrals for their Moving Through Mourning Grief group. This group is intended for students moving through grief or loss at various stages, which might include the loss of a parent, child, sibling, or friend. Meetings will be led with guided discussion and activities in support of participants addressing their grief and the ultimate hope of connecting with one another. Meetings are weekly on Wednesdays from 3:30 to 4:30 p.m. and they are offered virtually through Zoom. This is a free service for students at Appalachian State, and we are excited to welcome new students to join our group.
Invitation Needed is a free, informal drop-in group for Appalachian State University students. This group provides a relaxed and low-commitment setting to talk about struggles with motivation, focus, stress, isolation, or just someone to talk to about your day. We offer this safe environment for students to come whenever they feel they need extra support. Each session is facilitated by student interns at the Social Work Care Collaborative of the BCHS Interprofessional Clinic. Just as the name states, there is no invitation needed, and students can drop in as often as they wish.
For more information about the Social Work Care Collaborative, the services offered, and how to get started, you may call us at 828-262-4028. You may also email us at sw-ipclinic@appstate.edu. You may also visit our website at socialwork.appstate.edu/social-work-care-collaborative. Thank you, and we look forward to working with you.